Okay, so just like any form of stress, of course, we need to address this, and we manage stress by, like what we were saying before, with the stress management, like getting good nutrition, eat well, avoid those substances that might, trigger or worsen psychological reactions like alcohol or illicit drugs. Okay, and of course we need to do some exercises to help our body cope with the stress. Okay, and for our body to stimulate the release of more serotonin, which is the happy hormone. Okay,
right.
Also, and then we need to have a means to have relaxation, so do meditation, breathing exercises,
right,
and the importance of reaching out to others, okay,
right.
So bonding with family members, especially those who are living in faraway places, and especially our elderly, those who are retired and living in the outskirts. So you need to be in constant communication for them.
Dr. Ring, this is, I know some people that they're so stressed out. It's been going on. It's been going on for a long time, and there's people they're living in a fear. They have this fear of, like, especially when that first so-called positive came to Palau. There's people they're losing sleep at night, and instead they turn into alcohol or other drugs, or chewing biruna just to ease their mind. How do we deal with those people in the right way instead of going to alcohol and taking drugs and other things? How do we deal with those people?
Well, first we approach them in a non-judgmental way, okay, and see how it is actually affecting them in their everyday lives. Okay?
Yeah.
So if it is causing them dysfunction, okay, if they're not able to fulfill their work obligations, their jobs, and it's causing a strain or distress in their relationships, then we can tell them that those substances might not be the answer to addressing their problems, their stress, because some would say that like alcohol eases some tension, okay, but if you abuse it or you use a lot of it, then it also leads to depression, because alcohol is after all a depressant. So if you use a lot of these substances and you begin to develop tolerance and dependency, then it will also take its toll not just on your mental health, but also your physical health.
Right.
Yes.
Okay, here's another comment that I want to share with you. Obesity in Palau increased during this COVID-19. Why? Because people are confined to their home and they have nothing to do, so they turn on the television and then put all kinds of food in front of them and keep on eating because they're stressed out, have nothing to do. They cannot fly to other countries, so they're right there at home and feed themselves to death. So a lot of people gain weight because of this COVID-19. So how do we deal with those people? Instead of drinking alcohol, they turn to food and eat a lot of it, excessive food that will help, get them to the obesity or something that is not good for their health. And also diabetic people are just bored and tired, so they're eating more than what they need. So how do we deal with those people that eating too much because they have nothing to, they're bored, they have nothing to do?
Well, yes, that is important for us to find ways, to do some physical activity.
I see.
But like I said, exercise helps us feel better, because when you're bored, you are also kind of depressed. So it also takes feeling of sadness, and then it can lead to also feelings of insecurity or decreased feeling of decreased self-worth or low self-confidence. Okay, so especially when they see in the mirror that they are gaining weight, or you somehow get this feeling that you need to do something about it, but then the drive might not be there. Okay,
Right.
something about it, but it's good that there are organizations here that are organizing those fun walks or fun run. I can see there have been recent marathons or fun runs that has happened lately, and that is a good thing. Okay, so we can also encourage them. Well, Palau has lots of beaches, and they can swim. So that's another form of exercise that they can do here. They can walk, they can run, they can do biking, okay, and swimming. And hopefully there will be those who will take up the challenge.
Right. Because, the reason why, Dr. Bing, I say this because, I mingle with locals, people around my community. And, I come across people with the problem because of the COVID-19 pandemic. And they turn into, there's a drug abuse in Palau increase because I think this COVID-19 and they're bored and tired and confused, and tired of waiting. So what they do, they turn to smoking marijuana, too much alcohol, or just sitting down and eat and drink beer, and that will cause their body to expand, So I think those kind of people, do we have such a program in our in medical facilities or the main hospital that deals with the people that needs help because they drink too much or using drugs? Do we have such a facility that can help those people in needs?
Well, it's well, first of all, most of these people might be in denial. So that's one of the things that we should address. So, there are screening procedures that are available in our community health centers. Okay, and they can have their blood chemistry, their checked, especially their cholesterol, their liver function, kidney function, and have their checkup with their physicians, so they can see for themselves the objective findings, which might suggest that they really need to do something about their physical health. But it's also about mental health. Okay, so it's really important to see this as something as holistic and make our people here in Palau aware of these things that they might be doing, which can also be detrimental to their health. And as for the programs, I believe the NCD has programs regarding this, while the Behavioral Health Division, we also advise our patients, our clients, to also be physically healthy. Okay?
Right.
We address their psychiatric or behavioral health concerns.
Okay. Well, Dr. B, thank you so much, to share with us some of these prevention measures that we didn't know anything about, how to cope by, preventing ourselves from getting overweight or having problems with other diseases such as diabetic. So thank you for your time, and I think we took so much of Kafar and Victor's time, but I requested personally for you to come. Here's another thing that I ask you to do. I haven't seen you in person. I don't know you, but after you came to RIC, You ate and you left, and then they told me who you were. So I said, boy, I should have met you. So when you're in public, by all means, please, okay, tell us or just say, I'm Dr. Bean, I'm the psychiatrist at the main hospital, so we can come and thank you. Okay, because I don't know if I meet you, I don't know you personally. Okay.
Thank you also for having me.
Okay, thank you, Dr. Bean. Kapar gigi da karam lang mahaptol temi goming.
Yeah, they give you a wool magda mulingitra toktangan may. This is the reason why we asked him to come tonight. I think Tulig, every so often we need those reminders and words of encouragement.
Right.
For us at the EOC and first responders, we need to hear reassurance from a professional.
Right.
Sometimes, not sometimes, oftentimes we get so caught up in daily life, and then we have take care of ourselves and take time out just to, recharge and rejuvenate. So, thank you, Dr. Bing. I think Tulig will probably have him at least, come in once a quarter or once a month.
Okay.
At least have that time slot open for him, and
right.
It's also opportunity to Tulig for everybody listening to call in.
Unknown caller.
Okay.
There's a caller.
Yes, caller. Ali yung ilgop sangay?
Oy, malgop sangay, ilgop sangay tuloy ko ilal bebirgide.
Oy.
Agi maloring sa talkshow, magi maloring na sulit, dire maloring na sulit.
Okay.
Agi wa dire ka dire sip masin, ngarinya elatya kurang ngarinya ngalakam atra southwest telopong kapam.
Oy.
Engka dire ka kalmu oruse, magi kor oke ringi agi pora mutial idea wase. Kioren sepase ko masing mornya triple mora southwest tramambe.
Wase.
Okay, betul trip yang membeli yang habel mental ubem private il aku di atro hospital membeli. Tiagi dah ulang ke yogere. El anggal ngalakam soal rusus sebel ngatiam rusus sebel mursi. Orang nam sate alendi. Kalau mau kukur om dah sulit semua turis termo. Mama, pagi dia kemamel. Jangan sebel ada buku marat tiket terkini buku turis termo raikil legal support tak kan bitir.
Okay, kam halal ternya. Oi.
Aku ngerat toy makadmonge, mo sebel makadmonge me. Ada me kadmo kial quarantine ngarang.
Oi.
Leng setengahnya dia raikil kukara briefing Malaysia ngeke Vietnam mora erni.
Oi.
Bela tidak ruang afar mengil alge kereta dirgit.
Aritin.
Mama pagi mo amel mo.
Oi.
Ya gime gimo truras dai gidel. Kadmo gidel mo quarantine. Aku ben digri ngarabelau magdi saber mo membrar ko
Okay. Good question. Good question. Kapar kami serse.
Hindi kamal musulang ako lere, ngway say ako tuluul umrus ang aringira June 21. Malsuko mga diri kanya adal diri ka kalorus sorin mamrus dor eng segi dil mande a direct kanya open padra gym en sabira adal mamrus. Ese lomrael mora southwest ndia kal private lomrael ang ministry ra helda malengara olidiu lmon mamrus adal southwest part ra tegi di mass vaccination campaign na COVID.
I see.
Unfortunately, wal kora alsimr al-omrail hindi ka tadir adra uriol letia mol tokora uriol mamrus rarad hindi ka lomilil per se. And hopefully tulig maral mo niya te alara sometime in the future mo sabi ra adal algo kamo milil sa southwest olng sir economy. Selgo question ringil gire la quarantine gora imol belum southwest gat tablol belura maklol belura southwest direct state mangwal ngarakarang selvelaw mong dia quarantine endi di sodlo ay sa tirigel ngara Helen Reef am lamarus tirigegi dia blol gora a frontline ra border gider sale book agegi del dial losada kolera tirigel ko am lamarus milat telomra next week adi mora sonsorol ma puluana ma ato obey.
Okay.
Igegi din ngarse amrus selvol mrexel southwest and belaw rogil. Na cover the 16 state.
Ti omrara habalmente di halolar tourist mar passengers maditigel official ngategi de lomraela tirgel adra COVID-19 o ay kami EOC ma MOH merkong why say
dira kalngar ngar adra DEH sa AC dira kalmol momrula isera blue mo tsaka ralma
why say
dira kalngal entomologist tirgidle ID la dira kalmol mo o mesa kura telelarak terse makura wa rakas may kwa momrura asurberingira plura southwest.
I see. Okay, nabada ka questions Ernak?
Mala always tulik ako.
Kahal dungut alcohol Hindi nga riya temi mo dungut alcohol.
Oo.
Okay. Ali ngil ko singay?
Tulik malumil ko singay.
Okay, ngil ko singay.
Ito singay ko ka farma letter.
Oy.
Tiagi na ager mo na tiral pero ang amo mo yung Google di lang ang experience mo break talk show.
Oy.
Ager na wat tiagi. I got vaccine hindi ka blood expire na kumurget 6 months. No?
Okay.
Pero mga na belaw pero mo tial belaw mal. Di klasil sernie pero mo yung I got pretere la vaccine sabi el spoil tial life.
Why say?
Oy. Seguida para que o meru lager. Kita abro belaw, que al hospital begin. Kami specialist ngara level sega silar up. Qualified sega silar up wasi. Why guy didn't sera go didn't do the food blueprint.
Oy.
Sera export level test que wasi camera food blueprint.
Oy.
Or hindi ka expertise mo kung sendray garras al murak bungger. Kami result ni.
Ang elang kasi nga niya other qualified ang nga level el merur tegi de luriol waset yang awang rarak malupang wangarak PCL malupang igel scientific funding seringa spend kot mo krap lur belaw nga niya other merur tegi de luriol.
Baru ay say, sila yager.
Okay, kahalilen seringi kusulang raka.
Oo, kusulang.
Oy. Kabong ang tilibig technical kafar ka mariter ka molas mo len seringi.
Halaken sel got tilgarir ka far pol en sel ngerul garil.
Okay.
So sel got tilgarir igal vaccine na dilga kal expire. Alga sel me yang mal kal mokal ngarnya kaidan so lubeng wal gora ababir lo bangkel waseng makara umungot mokla oy ngara nga expiration date tringi. Me dito iceling kadam natal do isel wasegel J3 legirel expire June 23rd June 23 and this sayid al weekend tilo bata extension or expiration date tringi 6 more weeks.
I see.
O tamla USFDA amlal mutal extend ra agagi dele regil sayid dele vaccine na J3 Aigel dola bar el time el mother na ang aringiya atul garo sa lot number sel got lot number expire September eselong eru nga expire October.
I see.
Mangwadi so mamelwal malgora dara blum bol makloran rir wasay mama mal gargi klam adara pharmacy gargi kol el make sure en aigal vaccine na dia spoil maigal expiration date ringi mang dia ka ding lakra expiration date dola bal marusar adling en dial gire la kadmututa.
Why say me yani sel ice pack sel gide bel donate tria adra mariala sel minus 16 17 segide la almost in storage I like it and dia make sure and maintain dia ngara di elacids maluban ngara proper storage.
Ay ga ngaringi kaidan seringi ngaringi ababer lo bangel mulwa sa igang giri will store ang aral mangaral titil ice pack amrani sel me ngobang ngara al sel akuler ngaringi yak kadal ngara al sel lo otil wasi tiang la breaker sel cold chain al ubendir gumil mesegida do mesringal sumang green ndir wungil balgula segal qara dir ngal sel dim lakal matamal sel cold chain ringi ndir wungil algar esel me ngarnge gegidel ice box me didu to ice segidel amadar nama J3 at ligibel di al sal lo widel el Ysel Pfizer mlegirel store ringira a cell ultra cold freezer. Nandi nga regal regular ice box ngarngiya Ispak sa tilut kalgira la vaccine ngara a pharmacy ra hospital.
May sa tulig sa del cold chain wal gora girel di OCC wa a temperature tegi del vaccine sel tobdra a factory ramrigel malum wherever ablul adal masas kogi mel merala pharmacy gida girel maintain sa del cold chain.
I see.
Mero selbol temel omrus yang ania igel ku togubet sil klagdal el gora gule vaccine carriers lo spare adra pharmacy moraigal path for example ang artmaur sa gibo morus ang artmaur ngar sa igid el gule el di maintain ang igid el temperature at that time el tobder sa igid el vaccine carrier selbol orus ra at bolror del dosage mong selbuk concern ni gire la sunlight tendia el bol por ungila sil sel gora mede el gora samer magarang el matamal selong erul gera gira la expertise la tulig ang lomsa daras la wal tablol kaldel badingil la test la covid ngani tegi del PCR ngani antigen and then ngani antibody antigen manggil PCR tel swab gira del malaria sample malum specimen ra either ang umor koled malum tegi del lisnged المال مول المورا سلباقر عمر قولت سيجيدي مثل انتيجين هيجيدي يا سبيسيمين الغالك انتيبادي سيجيدي يا اسبي اراس بلوم serological test دي كده التايم واللغدو دورور سل لو اسبي اراس unless انجيرا من الغرا verify وسنغال اذن وغرات التلل نمو سوم مونيارا تم نمو كده الغرا او اسبي سيجيدي التست التايم هيجيد التبلو الانتيجين ما PCR الوالدي دو ولا سامبل وسبي اسواب هيجيد ادو روبل هذا لا برجيد توليغا trained
certified
هيجي equipment الدولا بديو سيسين ما يجي بيبيرا USAPIs in fact هيجي outside رقوا مسايبا هيجي مليغوت المو PCR before هيجي بيبيرا FAS of course ملانيا training ما ترجع subject matter expert tamlay mit make sure adara labrigid tirigal longra COVID-19 testing at trained OCC time adara labrigid make sure you got rogul testing platform validated
I see
dial mogaret el momistera result ring mungi la question ra na caller ndi segi dim
I see At so madira expertise gid nga nga neighboring island country sabi direct el sender of island mala opinion tira sum tiaka certified adang atyang
so sir ko remember sir walel ngortriel PUI sa kadam lesson na specimen of island kadam lesson del mura Hawaii ma sendel mura kwam Taiwan.
I see.
El alta mem la moda ka send sabi del ding artial belubela we test mum ding result.
I see.
Pai say gidel mo malang artial tial rak tel ngarangal adal wasit tiang tial original adang variant. Say gida dila kabul sabi del meruleringi.
Okay.
Masel tu momongan ngarak tel el mesois mangada mo sabi del mo sendra specimen pai sa del mo sendringi il moray gidel ko di makasaya labra blul ada sabri el tistri say gidel wasay tiang ngaral variant. Hindi tial malang alwasengal adang covid hindi ka tidorulan ngira sa blul belaw.
Okay, kahala dong tial kole kabong e caller
uy mal masaule dias command answer same question tial gara tourist el mora southwest berengel gal kama di ngwa urus tiang di baul brasi del tokol molgoring sel PPP do bringa president os graba mo public partner au lagi ulegel wa den sabe ro tourist el mo di tiang gira mal sokal para dire ngul ma attention ra farma diter mal gergit mai kinamo mo mal gergit di sokal mo ampal raisa ose language last time bagi mle golden di dimnak min wase kada mga lebus rasmer sel lagi tril mamu matao ma para ko di luasin wala ya kalungin lado ngalebus raran manggiregal mo careful ra lang mit sus pering le kada public forum mod hospital sebenarnya saja ada dongal busra ngul trial health pringil pringi masuma forum lo o gilo mara au deswela al bebirigi de gi ayamal wasin nagi min wasin tamo kalbus beso mamlo kor osiglo wasin so edel mohil pertiden ya
I see.
oh el asel
Isolation ako das ang appropriate ng tuwa Miguel.
I give isolation
Oh.
el asegi del dimne segi del PPP matil igi del isolation tegi del ora apalasizen mortil wasin giram los pe agragik ay gal langwis del mo pergi mo dia pergi merasing ada mo ngulo siagi ora so mamlang mengalebus ada lagi mles question so mama
well taken
tak proses tawar hospital ngi dia dos pe gat mo pergi mendiakal ngi dia isolated ra adal hulunga sorngil mo ngi ndagi mo lo ora mga simra ngi galebus
okay
oy magi ayamar tir gi ayamar khafara chung magi ora mo malitel wasagi ngi ora mo segi del oh ya mal besula biasa malung la program ra
okay ansula okay ya kita mla koli atas siga matru ilbu ere diungil tora se a help okay masulung gabigang esola edam duigel kuk somil dirgam dele sola ismria program lagi
Takam sulang itulig man masawlang gel caller o kita madingilo sa albang la korat talgib titukol time
pasti
ul makadamo kuk molingit ra Dr. Bing and may muk kora among lo arungud le bebi ra time makadaman
sum up to the gafar sum up to
makadamal appreciate taigel tigingel la caller
oy
pagsimal waisay kita gira del di kay ng zero ko
pasti
tokoira arak tamase gira del sik prolel sabab akil gitu rogo yung mga mga sulit.
Pasti.
Dapat tuloy kan di sa igid at sugum dia kango dari itu sih. Gimre nga sulem rogo callers ma direct kal the 8 era joint broadcast. Thank you Dr. Bing for joining us again and it won't be the last definitely. Makuk next tulig
okay.
Ito lutel makaptera talk show.
Okay. Thank you everybody.
Mesa balwal mabli takol wararaelang ngengi awe magata